We dropped our health insurance in 2025, and this is the question that I'm getting the most. So let me break it down. We were originally paying $1,200 a month for 5 of us to have health care through my husband. My 2 other kids have state care, and they will until they age out of that program. So $1,200 a month, and that was just our basic, just your basic PPO plan, okay? So they paid like 80% of most things. However, our copay to go to urgent care was $150. So every time we'd go into urgent care, $150 per person, okay? Our copay for specialist visits, I believe, was $100. Emergency room was $350. So our copays were still very large, and a lot of our medications were still very expensive. I was doing a monthly injection for my migraines that was $780. And at first, they had paid most of it, and I was getting it for $60. Then it bumped up. They weren't paying it anymore. They lowered the amount that they were paying it. It went up to $780. So I could not afford that with insurance or without insurance. I couldn't afford it either way. So I had to drop that medication, even though it's literally the only thing that has ever helped with my migraines to be preventative. So we were paying $1,200 a month for 5 of us. So now the insurances that we kept dental. So that's $40 a month. We kept vision for $24 a month. We kept critical illness for $12. So that's going to pop in if there is anything like cancer, heart attack, stroke, diabetes, any of those critical illnesses, that's going to come in then. Now that is not going to cover 100% or 80%, but it is going to help. It will be a cushion. We kept hospital indemnity. So that is $40 a month, which means if we are hospitalized, there will be a cash payout that we can put towards medical bills. We also kept accident and term life. So that is $10 a month. Sorry, that is $20 a month. Okay, so total per month for that, we're paying about $140, $145 a month. That's for 5 of us to have all of that coverage. So what we're doing is we are doing a direct primary care. That is going to be for all of our primary care needs, our family medicine needs. All 7 of us are going to go to the same clinic. So per month, we're going to be spending $280 for 7 of us to be in the same clinic. That's going to be all of our sick visits, our well visits, our urgent care visits, orthopedic visits, anything like that. This is what it covers. All in-person and telehealth visits. Okay, we've already used this. All 7 of us have literally already used this in the past 10 days. Annual labs for each person. All point of care testing, so flu,